A very good morning to everyone and warm welcome to today's IC. Small Town Postgraduate-Pave Neuron Pathway. Ophthalmology residents often undergo through certain phases of anxiety regarding many stages of their training. This IC is primarily meant to help residents to plan their academics, make timetable to get through their reading for their exam, to start research and publication during residency itself, and to plan for their future subspecialty after their residency. Our first presenter is Dr. Rakhi Dcruz, who is a consultant phaco-surgeon at Ahalya Eye Institute, who is an ex-LVPI resident, and she will be appropriate person to guide on how to prepare and plan for exams.
Good morning, everyone. I'm Dr. Rakhi, and I'll be talking on plan, prepare, and conquer your exam preparations. So during the first year, everybody has a lot of dilemmas in their head. Should I get all the books? Should I start reading the reference books too? And should I read every day? Should I start reading the DOS article from now itself? But I would suggest, if you want to know only the main basic symptomatology, standard definitions, and clinical examinations, a Parsons diseases of the eye and the Kansky will be more than enough during your first year. Start early and stay focused. Keep a scheduled time every day. Try to read every day, at least for 30 minutes. And learn from your clinics. Never miss an opportunity to see interesting cases. It's okay if you can't read every day, if you have some commitments with your friends to go out or like that, but try to make it a habit to read every day. Stay focused and stay organized. Start making notes and organize them, read and refer more, and add to the already made notes. So this is a screenshot of the note made by the gold medalist Dr. Harini. She has separate notes for each topic. Like for retina, she has a book, and in the first page she'll write down the contents, and for each cases she will highlight the main important things, and when she reads something from any reference article, she will either add on to it by a sticky note or she will cut and paste the article in itself. Other than Kansky, for some subjects like oculoplasty and for pediatric, you will have to read other reference books. So these are some of the suggestions for the reference books which are required for other topics. Once you become your exam-going PG, it is your time to make a question bank. So try creating a question bank or get it from your seniors and start reading the refraction and the basic sciences. Start preparing for case presentations and start increasing your study hours per day. The most awaited time, the study holidays. This study holidays actually meant for revision only. Try to make a timetable, and you have to keep the volatile topics like the optics and basics towards the end. When you're writing theory papers, try to be crisp and keep a format. For each clinical questions and for investigations, you have to keep a format in itself. For investigations, you have indications, optic, uses, contraindications, and recent advances. Be legible. Have a good handwriting. Even if you don't have a good handwriting, if you leave enough spaces in between, it will become legible and neat. Use a maximum of only 3 colors for highlighting and for underlining the important points. And you can use 1 or 2 flowcharts in your paper. Draw big diagrams and leave space above and below the diagram to make it look neat. And when you're labeling, label only on one side. Once we become the exam-going pages, we already lose the art of writing for continuous 3 years. So you need a mock test, or you can self-test using old question papers, and practice time management while writing. Stick to time. If you're not able to finish one question in time, try to leave spaces for writing extra, even if there is time at the end. If you don't have any theory classes at your institute, don't worry. There are so many online theory classes available. One of this site is from the RP Center AIMS itself. They have even classes on forceps and all the surgical instruments. So these are topics which are not taken at any of the medical colleges or institutes. So they have classes even on the instruments, their designing features, users and everything. Other than the instrument classes, they have topic wise classes also arranged, and they usually send it to your mail if you subscribe to their channel. And Shankar Eye Foundation has classes on the most important topic, that is recent advances like glaucoma drainage devices, OCT interpretations and such things which are not taught in colleges. LVP also has a set of classes which include best of LVP grand rounds, which is very important for preparing for your practicals. And other than that, this is a problem-based learning, which is one of my favorite, which gives a thorough and in-depth knowledge on each and every topic. Next, you have you and I. This is like a OSCE format where one person will be asking question, the other person will be answering. So this will be very helpful when you start preparing for your practical exams. And if you don't have long hours to watch, like for 1 hour you can't watch, there are such small short videos of 3 minutes which cover each small topics, which will also be very useful for your theory as well as practical exams. So once you start reaching your practical exams, stay calm, composed and be confident. But mind you, confidence comes only by examining patients, so try to never miss your clinics. You have to study this case performer by heart, and while answering, be audible and to the point. Practice make one perfect. So present cases whenever or wherever it is you are getting a chance. These are some of my suggestions of the books which you have to read for practicals. And while you're preparing for practicals, group study is a must, because in teaching others, we teach ourselves. And ask for help from your examiner, whoever is there during your practical exam time. And for practicals, there is this sessions by iFocus, which mainly focuses on the practical exam point of view. They even have classes on OSCEs, as well as lectures on refraction. This is another group which is called as a Spotify Eye group, in which you can get all the scans, pentacams, all the fields, OCT maculas and all the recent investigations with the tips to answer the practical exams perfectly. So most of this were taken by from Dr. Pranesh. He is not able to attend this session today. And my sincere thanks to Dr. Krati Gupta and Saurav Deshmukh, also from where I have taken the sources. Thank you.
Thank you, Dr. Rakhi. That was a wonderful presentation. Next.
So I do have one suggestion also. For paper 4, they'll be asking questions on recent advances, and for us they had asked retinal, we wrote during the COVID times, and they had asked questions on retinal surgeries during COVID. So there might be questions regarding, you should be focused on the need of the hour, and there might be questions for DNB.
Okay, next we have Dr. Anju Kuriakos, who is a consultant in Medical Retina and Uvea, Western Eye Hospital and Chaitanya Hospital, Kochi. And she is an alumni of Aravind Eye Hospital and herself is interested in contributing to online resources. She will be guiding you in how to use online resources for learning.
Good morning to one and all present here. Thank you, Rakhi, for this opportunity. So I'm going to talk about e-learning resources in ophthalmology. As we all know, as PG residents, we cannot carry these hefty books with us. So we all need some innovation, something to do our learning along with our practical OPD procedures. So innovation in technology have made everything online. So it is accessible to all, it is free and affordable, and we can access it anywhere at any time. So we can learn at our own pace also. We can multitask, for an example, we can cook and hear a podcast and do all such things. So this presentation was born out from an KGO article, Kerala Journal of Ophthalmology article. So there are the types of e-learning resources, which includes websites, webinars, YouTube videos, podcasts, and ebooks. I'll be discussing in detail about this. So for the website, iToday is one of the famous websites which includes latest news updates of ophthalmology and what are the conferences we can upcoming conferences, when is the last deadline for it, and for the PGs, especially for the PGs, they have this focal notes and this flashcards. So you can easily understand how do we, for example, how do we differentiate between an infective and sterile ulcer. These are for the last minute revision. It is very useful for us. Next is Ophthalmo Bites. This is by Shashwanti Mohan. It is very precise. Only the photos and few important points. It is also available in the Instagram recently. So next is Spotty Eye by Shana Sood. It is basically study slides, which is for the imaging purpose and basically for the OSCE purpose. So it is very precise. They'll give an image and the only one line explanation, so that you have to tell only that from when the OSCE is asked. Next is a very well-known website, eOphta, which has study materials, blogs. Most of us would have seen that, practicals, exam resources, fellowship advices for the ophthalmologists in India. So they also have the PowerPoint presentations, which is specifically for the basic sciences. Each and every category like cornea, cataract, glaucoma, we can take that, refer that for the last minute preparation. So next is eLearn. eLearn is by Dr. Kratik Gupta and by Saurabh Deshmukh. This is, most of us would have read this during residency, and it has notes, OSCEs and question bank, and in how to prepare for an interview for the fellowship purposes. They have this question banks. These are the examples of it. So next is the worldwide Wikipedia for our ophthalmologists. So it has all resources from A to Z of ophthalmology. So next is AIOS proceedings. Whatever we present here will be posted in the YouTube after 3-4 months, so that we'll be able to, even if we miss some session, we can definitely go to that and learn the session from that YouTube website. Next is a few outside India, abroad websites, which has clinical ophthalmology resources for education, grand rounds, lectures. Next is Retina Image Bank by the American Society of Retina Specialists. Next is iDocs, online community for ophthalmologists with IQ question banks for exams and courses in UK, not for India people. So next is the Muthuswamy Virtual University for Postgraduate. This is basically for how do we prepare for the ICU, FRCU and FRCS exams. So next is a well-known website, Atlas of Gonioscopy. Next is Orbis Cybersite, which is online courses and webinars by the Cybersite. Next is a collection of fun and informative videos. So how to learn ophthalmology, not just by seeing the human eyes. It is an animated one, so it will make it more interesting. So this is a fun intro to ophthalmology, again by Timothy Root. So this is for MRC of the exams. So next is a Neuro-Ophthalmology Virtual Education Library, which is learning and proceedings, which is happening if you are not able to. It is available in the audio and the video format. Next is iGuru. This is basic introduction to ophthalmology with flashcards and video lectures. Next will be the glaucoma lectures by University of Iowa and the famous RPEC rounds. It is a basic, all ophthalmology residents would have gone through this for preparing for the PG practical exams and all this stuff. Next is Ophthalmology Edge. This is clinical ophthalmology resources for education. Similarly for the grand rounds lectures and for the videos. Next is the AAO standard website for ophthalmic news and education. Not for this one extra thing is it is freely available for the members of AIOS. Only thing is we'll have to go to the website and register once. Next is Atlas of Ophthalmology. It is a multilingual atlas of ophthalmology, which includes everything from conjunctiva to strabismus, everything. Next is iRounds. This is a clinical rounds and image videos and tutorials for basically focused on the residents. Next is ICO e-learning for the people who are preparing for ICO exams. Retinoscopy simulator. So many simulators are available, like retinoscopy simulator, strabismus simulator, and for the squint, we have a software by Sudhir Singh. And next is podcast. Podcast is these are the very regular. I'll mention a few regular podcasts, which is very regular podcast on various journal of ophthalmology, and they have interviews from the ophthalmologist in this. And this ophthalmology off the grid is for the ophthalmic innovators to get inspired and motivate, and we will get ideas from there. How can we make it better? Next is for the retinal surgeons podcast by Jay Sridhar. Another retina podcast. This is yet another retina podcast. So this is snippets which covers by SN. It's ophthalmology topics and interviews which is happening from the Shankar Netralaya. And this is discussion for the exam topics. This is JAMA ophthalmology authors interview. How do we publish? What are the options available for us as a resident? Next is the smartphone apps. I'll mention a few. There's basic eye anatomy when you enter the residency to get an idea how the eye is oriented, how the muscles are oriented. They have a video, audio formats in this. It's a cataract surgery simulator. We'll get each and every steps. How do we do with this? There's also next is eye tubes. There's an eye grader app. I'll just skip a few. There are apps for also FRC of exams also. Other types of apps are also available. There are few YouTube videos which is OroTube. There are a few other YouTube channels which will give us an idea how do we proceed more. Thank you.
Thank you, Dr. Anju. That was enlightening and really practical tips. Any questions?
That was actually a very indeed good presentation on all the resources available. I think if we just go through that video, each and every person can actually see what you can get everywhere in each, like you mentioned, retina and cornea, which one is better. And also maybe to add to it, I think most of us nowadays use Instagram a lot, and there are so many resources and signs and symptoms which they put as a small clips.
Yeah, like
and
retina today.
Yes.
Yeah.
And that is actually very good, because when I see Instagram, there are some academic things coming in between, and that actually helps us. Sometimes in the clinics when we see a finding, or like, this I've seen in Instagram, maybe this is that, and
especially
all those
image-based ones.
Yeah, image-based ones, videos. And I think not just YouTube, I think in Instagram also there are a lot of videos which get. So social media is actually taking over, and it's all becoming e-learning. And anything on that? Any retina based or any other specialty based in Instagram?
There are few Instagram pages, which is like Retina Today, and
I think even Shishir has his Instagram page where he puts all his surgeries. So Instagram is one good thing. And now even IGO has launched its application, IGO app, last month, I guess. So we can actually get all those publications right in that application. Even provision to even submit the manuscript in the application itself. So that is also another thing. Any other comments or questions?
One thing we forgot is Telegram, from where we get all our books.
Yeah.
We all are indebtedly thankful to Telegram, I guess.
Our next presenter is Dr. Prithvi Chandrakant, who is surgical retina consultant at Arvind Eye Hospital. He has multiple awards and publication to his credit and would be the best person to guide on how to start research and publication during residency.
यार क्या हो गया इसको? Just a minute. Listen, can the next speaker talk?
Since there is some technological glitches, we'll go on to the next talk. This is by Dr. Vaishagi Prasannan, who is a ex-resident from LVP and currently doing pediatric ophthalmology from Shroff Eye Hospital, Delhi. So she'll be talking on what after residency, whether to go for a fellowship or to start your own private practice.
Good morning to all. Once you finish your residency, the actual questions comes. What next? And the answer to this is crucial because this answer decides the entire graph of your future or your career. First, we'll see what are the options you have after residency. You can join a fellowship, you can do a senior residency in a government institute, join a charitable hospital where you can do surgery as well as get trained in surgery. You can go join a good private institute, set up your own private practice, and also you have option to practice abroad. Okay, what are the questions you should ask yourself before you decide what to do next? Well, one is, what do you want to do in your life? What do you want to achieve? Or what is your goal in life? Where do you want to see yourself in 20 years? Where do you want to practice in the end? Whether it is a small town where you might need a comprehensive practice rather than a subspecialty practice, or is it a big city where you need actually to have any expertise in any subspecialty? Then what kind of practice is viable in your place? And finally, family, because ultimately you should have a good work and family life balance. First of all, we'll discuss about if you plan to pursue a fellowship. It's always better to pursue fellowship because it fills the knowledge gaps of your residency, as well as it helps you to gain advanced knowledge in a particular subspecialty, because some patients need actually expert opinion and management, and some conditions require a deep and vast knowledge and skill to provide them with actual treatment which they require. And it also helps you to gain more surgical confidence and training. But you should always know, do you have a genuine interest in a subspecialty so that you can pursue it as a career for lifelong and go deep into it. Also, you should know the demand and scopes of your hometown and should be aware about the professional saturation which is actually present. In fellowship, you should have to give a dedicated time throughout the 2 years in order to gain the adequate amount of knowledge and skill you require, and there should be adequate financial support also. Because by the time you finish your residency, you will be already in your late 20s or early 30s, where you actually are in a rush or in a responsibility to meet the needs of your family, and also you need to financially support your family. To pursue a fellowship at that point actually demands a lot from your family, and you need a proper support system both mentally as well as financially. Then one safe option, or it can be just considered as a transition phase, is that you can stay back in the hospital where you already got trained. Here it will improve your experience. It will be familiar environment where you can work at the same time as a consultant, and you will be widening your knowledge, and it will give you some time to get a broader perspective on how you want to establish yourself. Also, you can give your the academician in you a satisfaction. The other option is joining an already established institute. Once you plan for joining an institute, it's always a question whether you have a fellowship, and it's important. It's an important thing to have years of experience before you join as a consultant in any institute. The advantages of being in an already established institute is that you will have ongoing learning from others who are like seniors or already established consultants there. You will have an assured number of patients. There is no need of investment, and there is no need of any tension for that. Then you will have financial security, you will have a decent amount of remuneration, it will give you good work experience, and even you have any doubts regarding subspecialty other subspecialties, you can have easy referral and get the patient the best treatment they deserve. The concerns are that you will always have targets to achieve, which can be daily or monthly. You will have inflexible duty hours. The remuneration you can get is always fixed. And also you are just an employee like any other person, and the patient actually come for the institute rather than to you. Finally, it's solo practice. This is like being your own boss. This is the most challenging but the most rewarding since it's challenging. Here there is no ceiling to your earnings. Once you are successful, you can schedule your own practice, your own timing, and the way you want to practice. And the disadvantages of being in a solo practice is that you need a proper planning, you need financial support from the family, you will have huge bank loans, and you need to be comprehensive rather than a specialist, or you need to be tied up with other subspecialty people. And the stress and tension of failure and investment returns will be there all time. It takes time and more effort to establish yourself, and hence you need to be patient initially. You will have to manage your OT and OPD together, and hence you have to be a good planner for that. And one thing is that you will have to learn from your own mistake. The successful career in private practice requires a knowledge. You should have good basic comprehensive knowledge. You would have good surgical skills. Observational, clinical, and communication skills should be good, and your attitude and confidence should be good. That patient, like even if you know things, you should be able to convince convince the patient the same. And always the hard work, it's that which pays. Ultimately, there is no good or bad decision about how you plan your life to be. Never compare with the graphs of other people, because everyone will have different pursuits about your life, and everyone will have a different graph of their life. Always ask, what does your circumstances demand from your family, as well as the place where you want to practice. And more than that, this should be the actual question. What do you want to achieve in your life? What is your final goal? Because it's the work satisfaction that ultimately matters. Thank you.
Yeah, it was a comprehensive and very good presentation, Vaishakhi. And one thing to add is, nowadays it's actually impossible to get out and have a practice without having a good fellowship. But the issue with fellowship is that the remuneration or the stipend that we get during our fellowships is very meager, and it's not even enough to pay off the rent of the house where you're staying. So then you need a financial support from your parents. So if you are a male and you already have a family, it will be difficult for you to, it is a humiliating situation to go and ask your father again for money for another 2 or 3 years. And on the other hand, if it's a female, they'll start compelling you to have your baby. It's 35, you'll have GDM, and they'll start telling all the excuses, and you will always be stressed. Fellowship period is not that easy. So that is there, but you have to overcome that. You have to get training and expertise, because nowadays ophthalmology is also getting very much saturated, and you have to be the best if you want to be known. Yeah. So next presentation is by Dr. Prithvi Chandragant, and he'll be talking on research opportunities, and he is currently a surgical retina consultant in Aravind Eye Hospital.
Thank you, Rakhi, for the introduction. Sorry for the glitch, and I'll be talking about research and publication. So as a resident, we are always told about these three things: write exam and pass, attend conferences, CMEs, and also expect you to research and publish. But the only thing that you actually do end up doing is exam and pass. Write an exam and pass. That's the only thing we actually do. And in between maybe CME conferences again, but not that important. You don't give that much of important. But actually research and publication is very, very important, because whatever you read and write in the exam is the result of years of research and publication. So whatever you are reading and writing is a result of years of publications and years of research, which has been concise and given in a textbook, so that it benefits the patient and the doctor. So basically there should be an interest in doing the publication or the research. Otherwise it will just die off. You won't complete it. You won't have the passion to do it. And once you develop an interest, you can even talk to people who are like-minded and who have published earlier. And that will give you the push to actually start your publication. And once you start reading more article, you know what is out there. And you know what is the void or what is missing, and hence you can actually find those things and try to make the publication or research. And always start, you can start it from making a letter to editor or a case report, and get a hang of how to write a publication article, rather than just going initially to an original article. So you can start slowly by having because letter to editor in IGO is 300 words, so you can actually write it'll more easier to write, and you can understand the process of submission, and then you can actually go for the larger studies and original article. And having a name in an article is a big motivation factor. The first time I saw my name in a publication, it actually felt so nice, and I got the motivation to do more articles. And this was the first article which got published of mine. And so the subject, so what happens is, what the mind doesn't know, the eye does not see. So you need to know what is there outside, what is there in the literature, so that you can differentiate with the what is good for you to publish. So if you want, you can always write exams to keep yourself updated with the knowledge, with what is happening in the real world, and that will actually help you to know what is not there. And when you see something what is not previously described, it will strike you that you need to get this published. So that you need to have a good sound of the subject. And then the mentor. So mentor is one of the most important thing in your life, because that person will push you to publish no matter what. He'll help you when you're having trouble. Even if you have the starting trouble, he'll give you that push which you require to start with. And he can be the best reviewer. So if you write something and you give it to him, he can review it, and he can tell you those changes which you wouldn't have thought about. And because of his experience, so he'll be able to do that because of his experience. And he'll also tell you how to answer queries which come after your article is reviewed. So he's the one. So for me, it was Dr. John who has helped me with all my publications. Even yesterday, I had a talk to him, because I had some issue, and I had to speak to him. So he's always there for me, approachable. So you should find a mentor who could actually push you. And also while doing a publication, now you know that there's some void, and you know that this is not there. So you should ask if there's a good question in that article that you want to publish, and find enough and more literature and any other review articles which has these things or not, and then only go ahead with, because you cannot sit and write something which is already present, so that there is no novel thing added to the existing pool of knowledge. And when you see any case that is very different, a rare case, or you better do all the examination, all the documentation, all the findings, take images, because now we have multimodal imaging system. We have lots of OCTA, OCTA, FFA, everything. You do it and keep it, because sometimes when a query comes, you don't have few of those images, and then it goes off like that. So and one more important thing is to have a consent of the patient. So that is something which all publications ask. And having a basic knowledge of statistics will help you, even though if the complicated ones you can get it done by a biostatistician, but basic Excel and basic statistics you should be able to know, because it will help you a lot in writing the discussion. And Bhaiya, excuse me. हाँ? इसमें भी नहीं आ रहा. नहीं. अरे ये. And writing the manuscript. Write small paragraph daily, and refer a lot of articles to find out how to write these things. And never copy paste anything. Try to write it manually, because if you copy paste, there are some softwares which can actually sense it. And setting targets. So once you think about writing an article, you fix that 1 week I'm going to take, you should take 1 week, not more than that, because if you don't set a target, you will just keep delaying it. And softwares like Grammarly and Zotero helps you a lot in increasing the efficiency of your publication. And ask which journal you want to put, and these are the factors which you have to see if your question can be answered and can be published in which journal. So there are few journals like IGO promotes innovation, but I don't think there is ESCRS, Europe journals actually don't publish innovations very easily, but they like more of validation of new instruments. So all those things can be actually seen by going through their website, which one accepts what kind of publication. And always have these things ready. So write an article in this format, so that you can just interchange things according to which journal you are going to plan to put it in. And then having a proper ethics is very important. Having please get all these things done. One thing is plagiarism. Get your article checked for plagiarism, and there should not be any conflict of interest. Get it all signed beforehand. Even authorship criteria and the order of authorship should always be priorly determined, because then there should not be any conflict of interest later. And yeah, even copyright form has to be done even beforehand. And it is always a teamwork that gets this thing published. So one person, it's very difficult. Get a team who can help you with all these things. Thank you.
Prithvi, I do have a doubt. Like sometimes it is a paid journal, or the images has to be paid. So what you do about that? You take it on your own, or the institute pay for that?
See, if your institution is willing to support you financially, like now I work in Arvind, so when I publish an article, they are willing to support me financially up to a certain limit. So when I publish something in IGO, it would come around 10 to 15, something between that, and they are ready to do it. Something maybe other journals, maybe international journal, ask more finance. So that time what happens is they'll give this much, then the rest of the thing you'll have to put it from your pocket. So that depends on each institution. So that whichever institution you're working with, they'll have a set rules that they can support you with this much finance. So that is so that will be done by each institution. It varies actually. Otherwise, you'll have to take it from your pocket. Yeah.
Thank you, sir. That was a good, very crisp presentation and a good discussion after that. Now we'll have our next presenter, Dr. Hema, who is a Vittu Retina Fellow at Contrast Eye Hospital. She's an alumni of Arvind Eye Hospital, and she'll be guiding you about how to plan and pursue fellowship.
Good morning all. I thank Dr. Rakhi for this opportunity. I don't have any financial interest or personal interest on this presentation. So when you are doing comprehensive ophthalmology or when you are a general ophthalmologist, you feel that you have a variety of pathology to be seen every day. You can practice anywhere or you can earn sooner. So the question arises whether you really want a fellowship. So my suggestion is that the earning sooner is the only thing left for our generation. Variety of pathologies and practice anywhere was for our previous generation 10 to 15 years back. So for me, whether a fellowship is needed or not, yes, it is a big fat yes, you need a fellowship. And sooner the better. And as Vaishagi has already discussed, when you're planning for a fellowship, the best 3 things you need is an attitude which can cope up with the stress you are going to face in the institution. And the second thing is the feasibility. Feasibility means you have to see where you are going to settle. If you are going to settle in a small town where there is no provision for an eye bank, you can't be specialized in keratoplasty and go and practice there. The same thing happens when you want to be a vitreoretinal surgeon and you don't have a setup or an OT for a vitreoretinal surgery. You can't take a VR fellowship and go and work there. So always look for the place where you're planning to settle. And as we have discussed, for us, especially females, we need a support system. And for us, mostly it will be house help or our parents. So when we start the fellowship journey, we'll see for the announcement of dates, we need a curriculum vitae. We should write a test which can be preliminary or we'll have to write a final test also. And the last thing is the interview. I am here no one to suggest which specialty is best for you. That you have to search for yourself. But what I can suggest is that the specialty should be the one which you are passionate about. Don't get fascinated by the great videos you see in YouTubes or in conferences. The heroic surgeries which are done by the stalwarts in the specialty. Be practical and also see the feasibility in your place. So how to decide on the institute? You can discuss with the alumni of that institute, but how to get withhold to them is that in that case, these conferences and all helps us, and social medias. In conferences, you can meet people and you can have friendly contacts with them. And also through your seniors who are working in this institute, you can have a discussion with the alumni. So what should you discuss? You should always discuss about the clinical exposure. The present protocol means when you are doing a fellowship for 3 years, sometimes the 3 years is not dedicated to the specialty alone. The first or second year, there will be a general period, and you may get a specialty training only in the last year. So that depends from each institution. So you have to discuss what's happening in the protocol. Like some institute like LVPA, first 1.5 years you will be sent to a peripheral centers, and the later 1.5 years you will be getting an exposure to the specialty. This is very good in cases of an anterior segment surgeon, because in peripheral centers you will get to do all the cases like cataract, DCR surgeries, etc. So you will have a very good hand on phaco. But when you ask me for a posterior surgeon, 1.5 year training is very less. So always decide on the institute, their protocols. And also bond. Supreme institutes have their bond. And extended fellowship means in many institutes you can stay back for 1 or 2 years and you can increase your surgical exposure. How to apply? As we all know, we can search in the Google like this. AIOS are providing fellowship programs from each institute. You can click on the institute and they will show you the curriculum, the catalog. In the catalog, they'll be having the places, their branches, duration of the course, and also whom to contact. But again, this changes from year to year. You have to be updated about the catalog sometimes this may be updated 2 or 3 years back. So you should contact directly into the institute and also make sure that the duration and the position per year are the same. Or else what you can do is you can go to the site of the institute and you can search for the dates of announcement of the exams, etc. So to say is that most of the institute they'll be having 1 or 2 admissions per year for a specialty, and the number of seats varies. So you should be prepared 3 or 4 months before the induction course. Suppose the induction course starts in Jan, you should apply in September or October. If it starts in June, you have to start applying in March or April. So be prepared with your plan 6 months before the completion of course. That is, as soon as you are going to finish your theory exam, you should be ready with your plan for fellowship. The first thing is preparing a curriculum vitae. We know how to prepare the curriculum vitae, but we have to remember that it shouldn't be fancy. What they are looking is, should they take you or should they choose you to their institute? Stop writing like this hardworking, motivated, blah, blah, blah. No one is going to believe you. They know what you are. You have to work and prove. And research and publication, you should have a thorough knowledge about the topic you have written or published. If you don't have a publication, if you have in your PG time, it's okay. You can present your thesis, and you can, but you should know in and out of your thesis. The conference and presentations presented, conferences in graduation and undergraduation you can tell, but when you're telling a presentation, you should be prepared for the questions also. Sometimes the interviewer himself would have come for the presentation and he would have presented. So just don't blabber, you should know what you have attended and the topic also. When writing the references, don't write references of your friends or batchmates. Write a senior member who is your mentor or teacher. He should be able to vouch on your character. Preferably someone who is known to the panel. Your seniors or consultant will be having friends in the institute, so you can write their name as the reference. And also expect a double check. The institute may call this fellow and they are going to ask. So you inform the referees also that you have given his name as the reference. About the extracurricular activities, all of us take this lightly when we are writing a curriculum. Just don't write like listening to music, watching TV, etc. Be specific. Write a band name or a cricket team or any sports team name. What it helps is that it helps you to initiate a conversation with the panelists. The panelists may be interested in that band or a cricket team. So they will like notice you that this, when they make the final list, your name can be projected so that they have noticed this person by this band name or cricket team. So even writing the extracurricular activities in the curriculum vitae is important. So fellowship exams, some institute has preliminary, some has both preliminary and final. Institute like LVPA gives the study material. We have to study that and we have to write the exam. Questions will be from the general ophthalmology, all the specialties, and also from the specialties pertaining. So both you have to read, not only the specialties. And the tiebreaker is recent advances in the specialty and studies by the institute. If you are going to write an exam by AIMS, you have to know what are the studies done by the AIMS, because there is a chance that they ask the questions from that area. For interview, you know the dress code, no need to discuss. Better to both these dresses you can't wear. Better to have a formal dress both for males and females. And in interview, no one is going to judge your knowledge, because if you have a knowledge, you are not going for a fellowship. They know. They are seeing the attitudes. They will ask the questions like, why this institute? Why this specialty? And they also see the choice of specialty. So most people write 2 or 3 choices of specialty, but it's not useful. You should write at maximum 2. Try to stick on one specialty. Don't write 3 or 4 specialty, because then the examiner will judge you like this person has no particular aim. They have just come for a exam or interview like that. So better stick on a specialty always. Always have a ground check on your institute. You should know the history of your institute, which you are going to, about the faculty members and the board of interviewers. You can ask the people or PGs from there, because most of the time the interviewer panel will be the same, And the body of work of the institute, you should always know, especially in that specialty. They may also ask questions like problem solving and teamwork questions. They may ask like, one of your co-worker has done, you were doing in the other table, and one of your co-fellow was doing something and some mistake happened, what you will do? Then you will have to answer, thinking and answer. What they're expecting is your attitude towards the problem. Like, are you ready to work as a team? Are you ready to help? Also, if you have done something wrong, like you have instilled some drops, or the sister has instilled, when you are working, especially in the peripheral centers, you will have to take care of everything, like the sisters, the accounts, everything you will have to take care of, especially in prime institutes. So they will see whether you are ready to discuss this with the authorities. If something mistake happens, you should admit that to authorities, report to that authorities. Also, your mentality to work as a team. And they will ask about the future plans, the long-term future plans, where you are going to settle, your kids, your marriage, and also what you are planning for the bond, and whether you are trying to stick on to the extended fellowship commitment, etc. So if you have any commitment back home or family to take care of, be honest and discuss. So likewise, we can start a fellowship. Thank you.
Thank you, Dr. Hema. That was indeed an extensive and detailed description about how to prepare for a fellowship and how to plan. Actually, this might be a question among some of the residents, because does it actually matter where you did your residency? Because anywhere you have done, actually your knowledge and passion matters. Wherever you have done, you can gain whatever knowledge and you can have your passion. But does it actually matter when it comes to the fellowship interviews?
I can't say no to that, because the people who has done PGs in that institute will have an upper hand. But on the other hand, they will also see the attitude of the contestant. Even if you have done from a small town, as I have told, you have done a good groundwork of the subject and the institute, and you have shown the passion on how you'll be working on the subject, they'll be happy. I think they'll take the interview is what all matters than the institute where you have done the PG. So be prepared for the subspecialty questions in the interview, especially when they ask about the their works. They are anyway going to ask questions on their work in the subspecialty. So have a knowledge on that. That you can go through the interviewer, you can know the panelist and go through the works done by the panelist especially, and you can talk about that. Also be passionate about whatever work you have done, even if it is a small work you have done at an institute, that also matters. So interview is the one that matters, that also will matter, not only the institute where you have done the PG. And Vaishak is the one who recently has undergone a fellowship from Shroff. So can you discuss what was the interview and the entrance pattern in Shroff Hospital?
Actually, Shroff is very good institute for actually all subspecialties, and currently I am pursuing in pediatric ophthalmology there. So there also the interview, actually the thing is, actually what matters is they will have any way to assess your knowledge. There was an MCQ of like 50 questions, and after that there was interview where they had actually asked 3-4 like particular subspecialty questions. And actually also sometimes it matter because they'll also check what you have done previously, how much surgery you have done, and when ultimately it's your knowledge which matters, they will take into account if you have done enough surgeries and all. They will prefer such candidates, like because they know you are already like okay with your like SICS and like FACO and all. If they think you are okay with that, they'll prefer to select you. That they will have actually it's a prejudice also, because they'll think that you can move further to your like subspecialty surgeries and also. That is a like small glitch there, but ultimately what they measure is based on that MCQ and interview questions only.
But they can't take all seats from the premium institute, right?
Yeah,
there'll be so many seats, right?
It's there, and but I was just telling like that plays a role. Maybe
Yeah.
uh,
Yes.
it's also depend on the interviewer also.
Yes. Yes.
I think, is there any question or? I think this session was enlightening to all, and thank you for all my co-presenters and AOC for giving this opportunity, and thank you.